Welcome to InnoHEALTH Conference 2024. I am Deepshikha, your host for the InnoHEALTH Magazine podcast. And today we have with us Dr. Noor Fatima. Welcome, ma'am.
Hi, welcome. A small correction. I'm not a doctor.
Okay. Okay, you were called a doctor on stage.
Yeah, I was called, that happens a lot. I'm called a doctor and then I correct that I'm just a BTech. Have been working in the field for a long time, have worked with doctors, etc.
So we'll just restart?
Yeah.
Okay. Yeah. So you're Miss Noor Fatima?
Yeah.
Right. Okay. Okay. Good morning, everyone. Welcome to InnoHEALTH Conference 2024. I'm Deepshikha, your host for the InnoHEALTH Magazine podcast. And with me, I have Miss Noor Fatima. And if you would please make yourself aware to the listeners.
Hi, I'm Noor Fatima. I'm the CTO and co-founder at Easiofy Solutions. Easiofy is an AI in health company, and our first product is ImageX AI, which is an AI-enabled cloud care platform for a connected care platform for medical images. So medical images are X-rays, PETs, CTs, MRIs, all those sort of things. So what we do is we basically analyze the medical images and we provide screenings, diagnostics, and surgery planning, radiation oncology planning using our platform.
Thank you so much for the introduction, ma'am. So with healthcare experts like you are bringing AI in tech and using that evolution and stepping into healthcare, how has your transition been from stepping into a purely technical background into a healthcare one?
So it has been a little challenging at first. I come from a long years of working in the technology field, around 20 years. So for me, getting from a technology mindset to a healthcare mindset and bringing a collaboration of both. So, but now when I am into it, I'm working with healthcare workers, I'm working with leading doctors. So now I understand how this collaboration has to go on. In healthcare, if we think that technology can only solve the problems, it doesn't happen that way. There is always a human in the loop. So when we build digital solutions, we have to take care that those solutions are actually assisting the healthcare workers, assisting the doctors in and making their lives easier. We cannot just remove that person from the loop and think that the problems would be solved. It doesn't happen that way. When you go to rural areas and you deploy clinical health solutions which have been built in the technology, in the labs, it is a challenge because there it's not only about the technology and how it is solving. It is how the workflows are not affected, how the people are trained to do their work that is not effective. We do not become a bottleneck for them. So AI is a very tech word. Now taking it to a person and making him overwhelmed with that would not solve the problem. So our primary focus is building technology and building it in a way that it becomes assistive to them. It sits on their system and makes their life easier. It doesn't overwhelm them. It doesn't disrupt the way, basically disrupt how they were doing the work previously. And if we are disrupting, it has to be slowly, in a phased manner, so that they do not their work is not broken somewhere. So that also we have to take care, and that is I understood that when I moved to rural areas where I was working with hospitals, with healthcare workers, with PHCs, with CHCs, and I saw that how the work is being done there and how we can assist them. So that is one understanding that I bring as a technologist and working in the healthcare to my company, building the product roadmap for us.
Right. So you mentioned rural areas and how the accessibility still has a long way to go, and how you're trying to make it easy with your Easiofy solutions, right? What strategies do you think need to be in areas where digital literacy is, still needs to make longer strides? What strategies do you think policymakers are making or are upcoming for everyone?
So there has to be push from the policymakers for adoption of those technologies. But the systems are in place. If I talk about policy, the systems are in place. There are CHCs, there are PHCs, there are ASHA workers. So the systems are in place. Now what technology can do and what the policymakers can do is make it more efficient in solving the problems. Because we have seen that though the systems are there, still healthcare accessibility is a problem. But if that is followed in a very good way using technologies, then we could solve those problems. As the push has to come from the governments. For example, if I talk about ABDM or ABHA ID, etc., the government is pushing for its adoption, and it would make life easier. A patient would have all the digital record with on their hand, so that even if he moves from one area to another area, his healthcare is not affected. He can get the treatment, the previous scans are available, and all those sort of things. So a lot is being done, and there has to be many collaborations between the research institutes, AIMS, ICMR, Niti Aayog, who have to come together. The startups as technologists, they have to come together and devise systems to basically do that.
Right. So when we're seeing many advancements in healthcare and all of that, and there are many gaps to bridge for us policymakers and healthcare enthusiasts. We're stepping into the field. Well, we're really thankful for your input and people who are bringing such tech-based solutions and also keeping the underserved areas in mind. So thank you for your contribution and thank you for your time, ma'am.
Thank you so much.
Thank you.